And joining us now to talk about your health is Dr. Esther Kim Liu, Chief of Pediatrics at the University of Maryland, Baltimore, Washington Medical Center. Doctor, thank you for joining us.
Thank you for having me.
What's happening with measles? Long thought to be gone. It's back, but to what degree?
So measles was considered eradicated in the U.S. in 2000, but worldwide, measles has been around since 9th century. Is our first documented case.
How serious a medical concern is it?
So measles is concerning for a lot of different reasons. One is the long-term potential complications, but also because it's an indicator for us in terms of, especially public health, of our vaccination rates.
And historically, Maryland has done pretty well, right, in terms of the uptake of vaccines across the spectrum of things we vaccinate for.
Yeah, so Maryland is very lucky. We've maintained well above the 95% mark, which is what we consider to be really safe for our population. Throughout the country, though, especially since COVID, we've had a significant drop in vaccination rates, which is our concern from a public health perspective as we see these outbreaks occur.
So what's the most important information about measles that you want parents to know?
Yeah, so I think prevention. I'm a pediatrician, so for me, in terms of health, it's always about prevention. We'd rather prevent illness, prevent disease, instead of treating it after the fact. So we know that vaccination works. We know that vaccines are safe and effective. Obviously, parents have concerns. When they have kids, we're always a little bit more careful, more than for ourselves. Our children are so precious to us. So I think one of the biggest hits that the measles vaccine took was a paper that was published about a link between the measles vaccine and autism.
Big concern. I think that's been debunked.
It has.
But how do you prove to a parent, as you say, who cares deeply about their kids, that it's been debunked?
Sure. I think, with anything in health, it's essential that families and their healthcare provider build trust and a relationship. And with that trust and relationship, there can be that discussion and that passage of information, right? So I can give my families information of, here's what the science shows, right? Nothing is without risk. So I respect your risk aversity when it comes to your most precious child. But what I want to do and what I feel is my responsibility is to make sure that your child has limited harm, and we know what is the best information we have right now is that the vaccine is safe and it's effective.
There's a little bit of mixed messaging on that coming out of the Secretary's office at the Department of Health and Human Services, largely supportive, but still raising enough doubts for people to be concerned. So the antidote, you say, is having a good relationship with a provider.
Yeah, I think it's important for families to bring up their concerns to their pediatrician or to their physician. I think when we limit that exchange of questions, right, we really don't know what each side is thinking, and it makes it harder for families to get the information they need to make a good decision.
Yes, that's interesting. If you're in clinic with someone and the parent raises that concern, it sounds like you will not quickly dismiss it. You want to spend some time on it.
Yeah, I respect families who want to do the right thing for their kids, right? Unfortunately, sometimes we get our information from the wrong sources. I can't tell you the number of times I've had to argue with Dr. Google, but it is important for me that my families understand my sources of information and where they can find good sources of information. So they don't have to just do something because I tell them to do it. That's not the kind of relationship that we as a public health standpoint should have with the public.
The measles shot is the MMR shot, right?
Yes.
I actually got it. This is maybe 5 years ago. There was some degree of measles outbreak around the Baltimore area.
Yeah.
And I was maybe unsure of my history. My internist at the time said there's a blood test. We're checking your cholesterol or whatever. We'll just check if you're immune to the measles. And I was not. So I did the shot at my advanced age, and it was fine. But does it make sense for adults to check, or only in the setting of a confirmed outbreak?
So in general, we do have a small pocket of time where the type of measles vaccine that we had didn't confer lifelong immunity like our current vaccine does. So between 1963 and 1967, that we do have this kind of gap in coverage if you were vaccinated in that time.
That was me, absolutely. The gap in coverage.
Okay.
All right, so if a young child comes down with the measles, first, how do they get it, and what are the symptoms?
So unfortunately, measles is very contagious. So in the hospital setting or healthcare setting in general, if we do have a patient with measles, we consider that area contaminated for 2 hours, even after that patient has left. Because it's so contagious, and also because the symptoms don't present quickly, it takes about a week or two for people to get sick. A lot of times we spread it unknowingly much more than other illnesses that we might.
Is there a treatment, or it's relief of symptoms is what you concentrate on?
So it's really about treating the symptoms. So that's why we really want to focus on the prevention. Complications of measles are serious and unfortunately more common, especially in children, than other viral illnesses.
I get it confused with chicken pox.
Yeah.
You can tell the difference. How can a parent tell?
Yeah, so chicken pox is kind of like a little blister almost, and it's on a red base, very itchy. Kids are miserable from it, but more because of the rash, and they're uncomfortable. Measles kids are sick. They are miserable. They have high fevers. They do have a classic rash. When I teach medical students and residents who've never seen measles, we really talk about how it kind of looks like you poured red paint over their head. And so that rash kind of starts way up on their head and kind of drips down their body. That's kind of the progress of measles, whereas chickenpox kind of happens all over the place. The three classic symptoms of measles are also cough, pink eye, and really, really bad runny nose. So they are just really miserable kids.
When you talk to parents about vaccines, are there any in particular that they worry about? And maybe put the COVID vaccine in that list. Is that something you're currently recommending?
So we do still recommend the COVID vaccine with the flu vaccine in the fall. COVID is, a newer vaccine. I think people are getting more comfortable with COVID, and so people still wonder about the necessity for it. Again, when we are privileged to live in a country where deaths from infectious disease is much less. So worldwide, there's still annually over 100,000 deaths from measles. In
Wow.
the U.S., it's very unusual even to have one death. So when we had the 3 this year, it was a big deal. But worldwide, it's still a large problem. And we're now really a global community. We're traveling all over the place. And so when we travel, we're exposing ourselves and potentially bringing that back.
So when kids have their back-to-school appointments and checkups, you want this on the list?
Absolutely.
Very good. Dr. Esther Kim Liu, Chief of Pediatrics, the University of Maryland, Baltimore, Washington Medical Center. Doctor, thank you for your time.
Thank you.
We appreciate it.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.